Lower back pain, a common complaint among many, and new research out now showing it is actually the #1 cause of job disability worldwide. Analyzing data from 117 studies in 47 countries, 1 in 10 people suffer from lower back pain. Joining us now is Dr. Ben Baechler from the U of M Medical Center. Dr. Baechler, thanks for joining me.
Thank you for having me.
Does anything about this surprise you? We're talking about 1 in 10 people suffering from lower back pain, and it is the #1 reason people miss work or are disabled at work.
No, I think this study is a very good reflection of what we are seeing in clinical practice, and that is that low back pain is a major and leading cause of physical impairment and disability for our patients.
So what is it about the workplace? A lot of people are at computers all day long. I happen to be one of them. I don't have lower back pain, but a lot of people talk about it. Is the sitting position for too long a problem?
It can be. I think low back pain is the intersection of several factors. One is the natural anatomy of the body. The low back is a vulnerable point, twisting, turning. Secondly, sedentary lifestyle is increasing, and certainly sitting at the computer, leaning forward and not in proper ergonomic stature is a factor, as well as a lack of emphasis on prevention. There's a lot individuals can do.
You started to I could see you working yourself into a proper position there, and that has a lot to do with what can keep people from becoming afflicted with back pain, correct?
Absolutely. The mechanics of movement are something individuals can review with their physician. Something as simple as getting in and out of a car. Imagine how many times you do that in the span of a year. There's a proper way to do that, not the haphazard twist and turn, but actually and deliberately moving, planting, and rising can avoid stress and strain. Simple things like that can add up, and there's a multitude of those, as well as some more significant interventions.
A lot of people who suffer from back pain go, I hope I don't have to have surgery.
Yeah.
People have had bad experiences with surgery. A lot of people have good, but is that a viable option? Is it necessary in a lot of the cases, fewer cases than most people think? Give us a sense for how that works.
Surgery needs to be very cautiously considered. The studies are very, very clear. There is a selective population where surgery is of benefit, but in many studies, surgeries have proven not to be beneficial. So it's something individuals need to be very cautious of and be counseled by their physician.
All right,
They shouldn't rush.
You know this better than many. There are a couple different kinds of back pain too, and people at home are going, yeah, but I got that shooting pain down my leg, that sciatic nerve pain. That's different than just a nagging lower back sort of annoyance, right?
That is correct. I think when we think about back pain, there is really a category of what we call red flag symptoms. And there's primarily 3 I want the viewers to remember. Number 1 is if they start to develop inner thigh numbness, or what we call saddle numbness. That's very concerning. Number 2, loss of bowel or bladder function, a significant change, specifically the stool. That's very concerning. Number 3 is, of course, a functional deficit or a significant change in numbness. You actually need to get to the emergency room or go to your physician immediately. This can be a medical emergency.
All right. All good advice people should be aware of, huh?
Absolutely.
Get up and move around, right?
Well,
don't sit so much at the desk.
Number 1 thing, inactivity is the enemy.
All right. Dr. Ben Baechler with the U of M Medical Center. Thanks so much for joining us, Doc.
Thank you.
All right.